Good day, everybody. My name is Dan Lett. I'm a columnist of the Winnipeg Free Press, and I'd like to thank you for joining us for the first in a series of town halls hosted by the Free Press on issues related to reopening of society, reopening economy, reopening our institutions. There's a lot of concern, a lot of interest right now on how we're doing it and when we're doing it. Today, we're going to talk about vaccine mandates, which I think it's safe to say is probably not just the most divisive issue in the country right now, but it's the most divisive election issue. It might be one of the most divisive issues we've ever faced, actually, in the national debate, the debate over who we are as Canadians and what we want to be known for. And I think that it's also safe to say that on the issue of vaccine mandates, and we'll get more into that in a minute on what we mean by that, most Canadians do support a vaccine requirement to dictate where they can go, when they can go, and what they can do. A recent Leger poll identified 8 out of every 10 Canadians in favor of some form of vaccine mandate. That leaves 20%. But I think most of you know that 20% is making their voice heard in a very big way. So we're gonna talk about all the issues related to vaccine mandates, the moral, ethical questions, the legal questions, and the medical questions. And I'm not saying that we're going to convince anybody, but if you're going to go forward from this and be much more informed. Joining me today, because as you know, I am just the enthusiastic layman in the group. We need an expert to sort all this out. So I've gone to Professor Arthur Schafer at the University of Manitoba. He is one of the country's foremost bioethicists, and he's also the founding director of the Center for Applied Ethics at the University of Manitoba. Arthur, thank you very much for joining us today.
Really nice to be with you, Dan.
So the first thing I'd like to talk about is perhaps we could just very quickly define what is it, when we say vaccine mandate, what are we talking about? Are we talking about forcing people to get a vaccination, or is there something sort of more complex and nuanced about it?
There is something more complex and nuanced, and it's kind of ambiguous because a number of governments and organizations that have announced vaccine mandates mean different things by it. So if taking the vaccine were required by law, where you could be punished where anyone eligible who didn't get the vaccine were to be punished, I guess you could call that a countrywide vaccine mandate. You've got to take it or else a fine, prison, drawn, quartered, and hanged. Canada hasn't done that. No country in the world has done that. And I think it would take the most dire of emergencies before any government would think it was even remotely justified to force unwilling people to coerce them at the cost of being punished legally to get the vaccine. So when the phrase is used now, as it's very commonly being used, what's meant is that if you want to go to watch the Winnipeg Blue Bombers defeat mightily the Saskatchewan Roughriders at the Banjo Bowl on Saturday, you're going to have to show proof that you were vaccinated. So a vaccine mandate means if you're going to be on campus at the University of Manitoba, you've got to prove your vaccine status. The federal government has announced that all federal workers will have to be vaccinated, and all workers in the industries that the federal government regulates. So that's transportation and telecommunications. So that's one sense of vaccine mandate, but even that's not so very clear because many places that have vaccine mandates don't require that you be vaccinated. In fact, if you look at the legislation, the province of Manitoba has published, you've got to be vaccinated for this and this and this. But in every one of those clauses, it says there'll be a medical exemption. So if you've reacted with a severe adverse reaction to the first of the 2 shots, you would be exempt. You wouldn't be fully vaccinated, but you wouldn't be excluded from any place where you wanted to attend, even though you're not. By the way, I sort of say, just as an aside, the provincial government has passed this repeatedly in all the different clauses of its legislation, but they don't recognize any grounds for exception. So it's kind of stupid at the moment. Anyway, so there's one thing. And then some places say you've got to be vaccinated, or you have to be willing to take a rapid test every day or twice a week or 3 times a week. So that isn't exactly forcing you if you want to be on campus. We don't know what the University of Manitoba are they going to require that you actually be vaccinated, or will they be allowed? Will you be allowed to present a negative test on the day? So I'll pause there.
No, well, I mean, it is. It's and country to country, a lot of different variations of the vaccine mandate. But I think we could probably agree that in general, vaccine mandates are an attempt to limit what unvaccinated people can do and where they can go.
Absolutely, it restricts their liberty. And or it imposes they'll have to be masked, they'll have to be distanced, they'll have to have a rapid test, whereas the vaccinated won't.
So and I know that you're not a medical doctor, and nor am I, but I think that we, both by virtue of the kind of work that we do, we follow the state of things in the pandemic. Do you sort of believe that there are 1 or 2 characteristics right now to the pandemic that explain, I won't ask you to justify a vaccine mandate per se, but explain why there's been such a strong move towards mandates in the last little while?
Yeah. Okay. So the Delta variant has really changed everything, because it's so fiercely infectious that in places where it's dominant, which is Britain, where it's totally dominant, most of the United States, and increasingly in Canada and Ontario, for example, and it's clearly going to come to the other provinces, it's highly infectious. And so the first point is that there's a real risk, even with most of our population vaccinated. I think we're at 75% fully vaccinated of those who are eligible. That doesn't include children. 75% vaccinated, and initially people thought that'd be enough. The virus would die out. We'd have herd immunity. But the Delta virus is so infectious that people who are unvaccinated they're sitting ducks. Not just to be infected, because even those who are vaccinated can get breakthrough infections. Just a little sidebar here. If you compare in the United States, the states with the lowest vaccination rates and the states with the highest, the incidence of COVID infection is about 4 times higher in the least vaccinated states. So that's with Delta. So you do get serious, significant protection against being infected if you've had if you've been fully vaccinated. Okay, so nevertheless, quite a few people who are fully vaccinated are being infected, and we know from an alarming study that the Centers for Disease Control published last month that that the viral load in the nose and throat of people who were fully vaccinated but who nevertheless were infected was as great as in the uninfected. That alarmed a lot of people, especially those who were vaccinated. But I think it was misunderstood. It doesn't matter what the viral load is in your nose and throat, it's what happens to the virus. And if you're fully vaccinated, you're extremely unlikely to get very sick and end up in hospital, exceedingly unlikely to die, and very much less likely to transmit the virus. So here's the main problem. Our healthcare system is likely to be overwhelmed by the unvaccinated who become very sick. And what that means is that people whose lives could have been saved won't be saved because there won't be room in the ICU, or there won't be hospital personnel to treat them. And the other aspect is that people who need cancer treatment or treatment for their heart disease, or people who have arthritic knees and hips, everyone's treatment is being delayed because our system is on the brink of collapsing. So to protect society, to protect the unvaccinated themselves, to protect society, to protect our healthcare system, there's a very strong movement to get as many people vaccinated as possible and to restrict the liberty of the unvaccinated, because they pose the greatest risk of getting infected, of infecting others, and of becoming seriously ill and threatening our healthcare system.
So there's no way getting around the fact, and we shouldn't avoid it, that a vaccine mandate is an infringement on the rights of the unvaccinated.
Absolutely. It severely restricts your liberty, because it means you can't go to the Bomber game, you may not be able to be on campus, you might even lose your job, or you may be forced to work from home if working remotely is possible rather than being with your colleagues. You may not be able to go to bars or restaurants or concerts. Yeah, it can be
an airplane.
Serious, or to fly or travel on a boat or on a train.
Yeah. So, okay, so let's go through, there's really, like, we've actually, I think, covered the medical threat, like the medical argument in favor of mandates. But the two others that are sort of hanging out there in the debate are the legal arguments, and then there's the moral ethical argument. So that would be the legal, can I do it? And then the moral ethical is, should I do it? So let's talk about the can governments impose mandates. Is it legal for a government to restrict the movements of unvaccinated people by requiring proof of vaccination?
Well, the Canadian Charter of Rights and Freedoms guarantees freedom of association, freedom of movement, freedom against discrimination. So those who say these vaccine mandates are limiting or restricting or violating my fundamental charter rights are correct. Point one. Point two, none of the charter rights is absolute. And what Section 1 of the Charter of Rights and Freedom says is what the other sections say what your fundamental rights are. Section 1 says, and the government can't violate those rights unless it can show that it's demonstrably necessary. They can't just say it's necessary. They've got to have good evidence or proof that it's necessary to promote some pressing or fundamental social value. So in the case of vaccine mandates, the fundamental value is to protect the lives and health of other people, including the vaccinated, who can get breakthrough infections from the unvaccinated or from other vaccinated people, to protect other people, to protect our healthcare system, to protect society, to help us get back to some semblance of normal life as quickly as possible by restricting the number of infections. So can it be justified? You could go to court if it's the federal government that's restricting your liberty, and you could make a charter challenge. They're very expensive, they're very slow, and it's not at all clear you'd succeed, because the federal government might be able to show that their goal was pressing. I'm sure they would be able to show that. They've also got to show that it's necessary, that there was no less restrictive, no other less liberty limiting way for them to achieve their objective. They've got to show it'll work, and they've got to show that it's the best way, and they've got to show that they're preventing more harm than they're causing. Because vaccine mandates cause harm to the individuals whose liberty is restricted. So the government would have the burden of proof. You could challenge them in court. Hasn't happened yet on this issue, but it almost certainly will. Now, if it's a provincial regulation, or if it's your local pizza place or bar or restaurant, or if it's the Blue Bombers you want to challenge, then It wouldn't be the Charter of Rights and Freedoms. That's for challenges to the federal government. It would be you could make a challenge under each province has its own human rights legislation. So it would be the Manitoba Human Rights Act. Or if you were an employee, you might challenge under employment law. And again, the tests would be the same. Whoever's restricting your liberty, the restaurant that's keeping you out, or the bar, or the university, would have to show, or the provincial government's regulation, they'd have to show that they had a pressing objective, a really overridingly important objective, that by restricting access, restricting the liberty of the unvaccinated, they were doing something that was going to promote the objective, and that there was no other less restrictive way. They've got to make reasonable accommodation. And I think that's why the provincial government legislation has built into it an exemption on medical grounds. And if you can work from home and your employer fires you, you could sue them for wrongful dismissal. So that's what would be litigated under either employment law or under provincial human rights legislation.
So I think that the key to perhaps achieving, I was going to say national consensus, but maybe I'm setting the bar too high, but some sort of a national agreement on whether or not legally these are mandate is justified really comes down to whether or not you agree that the threat is clear and present. And a lot of people have drawn a lot of parallels, and you may have a better one than this, but it's the idea that our right to drive a car is limited by government. We have to behave in a certain way. We have to make sure we do certain things like get a driver's license. We have to refrain from doing things like drinking and being under the influence of drugs or alcohol. But I'm not saying there aren't people who are opposed to driver's licenses, but we've accepted them because we accept that an unlicensed, intoxicated driver, that would be a bad thing. So we agree. In your mind, one of the interesting things about this debate is that not everybody agrees that COVID is a threat. And there's sort of an intersection of those two issues. Is that sort of the way you're seeing it as well?
Yes, I think you put it very nicely. Look, if COVID is a hoax, there are some people, not very many, who go on the internet and find conspiracy theory. If there's no real threat, then you can't justify restricting people's liberty. Or if there's a real threat, COVID isn't a hoax, it is an important threat, a worrying threat to public health and to our healthcare system. But if you think the vaccine won't work, doesn't protect people, then restricting liberty for the unvaccinated again won't be justified. Or if it'll work, but it's going to cause more illness and sickness than the virus, then again, it wouldn't be justified. So good ethics requires good facts. If the facts, as claimed by public health officials and by most scientists, are correct, that COVID is a serious threat to the life and health of individuals, but also to our ability to function as a society and to our health, if it really is a threat, and if the vaccine really is safe and effective, then that information would generate the claim that just as you can't, our government hasn't banned smoking. It's your liberties and individual. Smoking is very, very deleterious to your health. One of the riskiest things you could do. You're not forbidden to smoke, but you are forbidden to smoke in public places. You are forbidden to expose me unwillingly to your secondhand smoke. So similarly, no one is proposing, at least at this point, that anyone should be forcibly vaccinated. But if you're not vaccinated, and if the evidence shows that you pose a threat to society, then your liberty of movement, your liberty of access might legitimately be restricted.
So, okay, that's fantastic. So we've dealt, I think, and my apologies to those of you watching, these are incredibly complex things. I don't know if you can see the beads of sweat appearing on my forehead, on Arthur's forehead. We're involved. This is a sprint to get through a very complex subject. So as long as we can accept that COVID is a clear and present danger, then legally we can impose a vaccine mandate. The flip side of that coin, though, is whether we should do it. That's the moral, ethical side. So I guess I'll just put it straight to you. Is this something whose time has come? That everything taken all together, that morally, ethically, we can justify the infringement of individual rights in pursuit of a larger goal?
It kind of looks, Dan, as if the alternative to restricting the liberty of the unvaccinated and trying to limit the harms of COVID-19, it looks as if the only alternative is permanent lockdown. So the argument is, by restricting the liberty of the minority of people who are unvaccinated but not the tiny minority who should be medically exempt, by restricting their liberty, we're promoting or permitting the rest of society to resume a simulacrum of normal life. So we've got liberty against liberty. Your liberty to swing your fist stops when it gets in the vicinity of my nose. Your liberty to smoke, okay, I made that point. Your liberty to be in a crowded bar or a football stadium, outdoors is normally much safer. So no one's being restricted from walking in parks or walking on the streets because they're unvaccinated. But if they're going to be crowded together, then they do pose a risk. So the ethical point is, we want to minimize harm. We want to restrict people's liberty to the least extent possible. So unnecessary restrictions, useless restrictions are justified. But the end does justify the means if the end is to save human lives, prevent human suffering, protect our healthcare system, and enable society to get back to normal functioning. So in this case, ethics, legality, and morality tend to coincide. The criteria of the Charter, listeners might want to go online and look up the Oakes test, OAKES. That's the test the Supreme Court uses when the government limits liberties, violates the Charter. They apply the Oakes test. And essentially, I've given you the Oakes test already in our previous discussion. And that's also what good ethics requires. You want to produce the most benefit and the least harm to everyone who will be involved. You want to protect the liberty of as many people as you can, and and when you have to infringe liberty, you should do so minimally.
So I think I've always, in sort of a big reveal to the audience watching, Arthur and I talk a lot. It's one of the great things about my job is that I get to talk to people like Arthur all the time. But one of the things that he and I have discussed is the odd spectrum of opinions about the legal, moral, and ethical considerations. And I think that you have observed to me, if I'm not giving anything away, that there are people in this country who seem to have alarmingly similar credentials to your own, who will describe vaccine mandates or mass mandates as the slippery slope to, some evil government intention. And should we be surprised or alarmed at the variety of opinions that exist on these things? And how can an individual person get to the good information? How do you cut through all of the bad information and get to the good stuff? Okay,
so there is consensus on some points and dissensus on others, as you rightly note. There's a lot of concern about vaccine passports. That plastic card, I have one in my pocket, and perhaps some of the people participating in the webinar do as well. You're going to pull yours out?
Yeah, full disclosure, there I am.
Okay. So one of the concerns is the diminution of privacy. People are worried that that if the young person in the restaurant to whom you have to show your card, that they're going to know something about your health status. I was participating in an open line radio show in Alberta, and one of the callers phoned in and said that having to reveal his vaccine status to another person was equivalent to them discovering that he had a sexually transmitted disease. My jaw dropped when I heard that. I mean, I can't think of any less significant information about my health status than the fact that I've been vaccinated. So I don't see this as a big loss of privacy, but people are concerned that the QR code, including some of my bioethical colleagues, the QR code will enable you to be tracked, kind of big brother dystopia, or that it'll allow people to gain access to your health records, which for many people, I suppose for all of us, are that sensitive private information. So my response to this, I think they're legitimate concerns, and some think it's a slippery slope, as I sort of suggested earlier, towards a totalitarian or an authoritarian state. So my first response to this is, I think privacy is important, but it's not an absolute value. And this, to my mind, maybe not to yours, I'm speaking to the people watching, maybe not everyone would agree with me, this violation of your privacy requiring you, before you get into the investors group field, that you show your that you've been vaccinated or that you're medically exempt, that should be confidential, right? You show your QR code so nobody has to know. I see that as a pretty minimal invasion of your privacy. Well, what about getting access to your whole health record? It doesn't happen. All they have access to is via your card, or the QR code is the information that you've been vaccinated. So look, any technology can be abused or exploited. So any new technology could say, hey, we start here, but we're going to slide down the slippery slope and end up in a snake pit at the bottom, and we'll really be sorry. But we've got strong privacy protection laws in Canada, and our government is not like Vladimir Putin's in Russia or the Ayatollah in Iran. There's, by the way, many countries in the world have vaccine passports now, especially in Europe. I'm not aware of any problems of abuse or misuse. Mm-hmm. There are some problems with forgery, which is why the federal government ought to have created a national model for a vaccine passport that was forgery proof and privacy protecting. They dropped the ball on that, to my regret, because I'd advised them months ago that we needed one. Each province could then decide to adopt it or not, because it's provincial jurisdiction. Anyway, I see why people are concerned. Mm-hmm. But, I think it's a problem of design. You just design the passport so that it doesn't violate your privacy. All it shows is that you've been vaccinated, or the QR code might include information that you're exempt, and that you're not trackable. By the way, any of you who carries around a Visa card or a MasterCard, what's this worry about being tracked? Or you're on Facebook or you Google. I mean, there are real informational privacy concerns in our society. I think the vaccine passport is not one of them.
So does it occur to you that there has been some progress moving towards a more educated, but also, again, consensus is a tough word, but more agreement on this? I mean, at the University of Manitoba, initially, they said no mask mandate, no vaccine mandate. They said they got all their legal advice. They studied it every which way, could not be done, not reasonable, not practical. And I think that whole situation, about 4 weeks later, they came back and said, well, first they said masks, and then they came back after that and said vaccines. And I don't want to disparage the university for what they've done, but in a way, is this progress? Are we making progress?
It's kind of interesting. You correctly described the University of Manitoba was very slow to come to its decision about requiring that, which they do now, by the way. So the rule at the moment is no one, no staff member, no academics, no students, and no guests can be on the campus who isn't vaccinated or exempt. Now, we haven't seen the details, and I don't know whether they're going to make a reasonable accommodation for those who should be medically exempt, but that's the rule they have now. I have to say their initial rule seemed to me not adequately to protect the health and safety of the students and academics, teachers who work on campus. And there was an uprising. People were, the academic staff said, look, you're wanting us to be in this workplace, and we're working in old, poorly ventilated buildings. We're teaching classes of students, maybe 100, maybe 80, maybe 150, closely packed together. This is a perfect breeding ground for vaccine infections. We've got to have more protection. And the administration, after the University of Toronto and various other universities took the lead, our university did, I think, catch up, although we're still waiting to hear the details. They should reasonably accommodate, I've said this several times, but I'll bore you by repeating. I mean, they've got to reasonably accommodate people who can't be vaccinated, and wherever possible, people who choose not to be. I mean, if your assessment of the risks and the benefits, if your assessment of what's best for you, maybe even on religious grounds, is not to be vaccinated, we should let you take your classes by Zoom where that's possible. We should let you do your shopping online where, the idea is not to punish the unvaccinated. Mm-hmm. The idea is to protect others, to protect society, and to protect our healthcare system, not to shame or humiliate or punish those who've made a decision not to be vaccinated.
Now, I think it's pretty clear from the events, both during the federal election and also this weekend in Manitoba, where a certain political leader who, and I'm not naming him because when I name him, some of my readers become a little hostile. So I won't name him, but clearly there is I don't know if it's a growing movement, but there is a pronounced presence of people who believe that they are being punished, that they are being shamed. And they have begun to respond louder, become angrier. They've become, in some respects, violent. We've had a little bit of violence on the campaign trail. So let's talk about the so-called anti-vaxxers, and I use the term anti-vaxxers in my columns, and I'm acknowledging that it's kind of an unflattering term. I wish there was, we will call them the vehemently vaccine hesitant, for lack of a better term. But this group of people. So what is it really? Is it just being forced to be vaccinated? Or it would occur to me that in the Venn diagram of this community, there's a lot of stuff going on. There's a lot of other issues being drawn in here. So let's talk about who these people are and why this issue of vaccine mandates in particular seems to have been such a catalyst. It's had an incendiary effect on the debate. How did we get here?
Okay, so let me just start by saying there is a wacko fringe of people who reject vaccines on grounds that are totally idiotic. Let's put them to the side, because I think most people who are, and I'll use the phrase vaccine hesitant rather than anti-vaxxers. I mean, there are some people who are, as you described them, anti-vaxxers, but most of the people who haven't been vaccinated yet, who are eligible to be vaccinated, are vaccine hesitant, And I want to say they shouldn't be shamed or punished, partly because many of them have good reasons. So, for example, the uptake of vaccines has been smaller amongst racialized minorities, many of whom are quite vulnerable to COVID-19. So why has there been, and if we look at why people are vaccine hesitant, we can think about how best to respond. And I think humiliation, shame, and punishment is generally not the best way, although when people are throwing rocks, then yeah, I mean, that's a criminal act. Some of the people who are watching this webinar will know that the experience of Canada's Indigenous people or Black people in America with the healthcare system has often been really unfortunate, hostile, discriminatory, prejudicial. So there are lots of people who don't trust the healthcare system. And I think there's a way of assuaging their doubts, of reassuring them, including the leadership role of the people in their own communities, of Black doctors or Indigenous doctors. But I think we have to take that seriously. There's a second source of vaccine hesitancy, and that's suspicion of big pharma. Mm-hmm. And frankly, a lot of the scholarly articles I've published in the last 20 years have been about the corruption of research ethics by the funding by big pharma that does manipulate the results and that does suppress the results that it doesn't want. And all of the Johnson & Johnson, Pfizer, they've been fined, not millions, not tens, but hundreds of millions, billions of dollars in the last decade for in civil and criminal penalties for various kinds of fraud and violations of research ethics. So to be suspicious of pharma strikes me as sensible. I mean, I think people should be. And I think it's scandalous that all the data has not yet been disclosed. I mean, that's something that we owe to the people who are skeptical, and I include myself in that group, about the integrity of this hugely profitable business. I mean, they're making billions of dollars. Are they being honest about the risks, about the effectiveness, about the data that independent scientists should get access to? So I certainly wouldn't hold in contempt anyone who had those doubts, because I have them myself, and I think what we have to do is we have to say, look, let's look at real world experience. The countries where people are fully vaccinated, I mean, where high percentages fully vaccinated, have to date virtually no deaths amongst those. I mean, it's exceedingly rare for fully vaccinated people to be killed by COVID-19. It's extremely rare for them to end up in the intensive care unit requiring critical care. There are more breakthrough infections now, as I mentioned earlier, with the Delta variant than there were with previous variants or with the original COVID. There are more, but many are asymptomatic or would be a very mild flu. And so the vaccines look as if they are overall very safe, vastly safer than actually being infected with the virus. And it looks as if you're less of a risk, significantly less of a risk to others, because there's all that viral load in your nose and throat, but then the antibodies produced by being fully vaccinated destroy it and make you get over it quicker, and you're less infectious. You can be infectious, but it's maybe a quarter as much, based on the latest data analysis I've seen, quarter as infectious as someone who isn't vaccinated. So I think we've got to keep an open mind. We've got to look at the data and the real. Some people say, but what about in the long run? A year down the road, 2 years down the road, will vaccine harms then emerge as there isn't good evidence of that at the moment. There's lots of evidence of the benefits. Our society has decided that it's a reasonable policy to save lives and get back to normal as quickly as we can to go with a vaccine.
Right. So lots of interesting stuff to unpack there. It's tough. I got to tell the audience, it's tough to ask follow-up questions because there's like 19 things that Arthur just said that I think is worth following up on. But I think a lot of us, as I have conversations with people, I'm sure, I have a funny feeling that a lot of people come to you and say, my husband, aunt, father, son, or what, my best friend won't get vaccinated, or is really angry about talking about it, really angry about the fact that they're being limited in what they can do. How do I talk to people like that, and in a way that will be persuasive and not incendiary? And realizing that some of us may in fact live under the same roof with some of the really far out there conspiracy theorists. So do we just have to rely on the fundamentals of good communication, or is there any key winnable, absolutely sure to win argument that we can use?
Yeah, well, I think with some people, I think there's absolutely no chance to persuade them. Partly because wearing a mask and or being vaccinated have come to be part of the identity of some people. It's part of, I suppose is it called the People's Party, or certain large C conservatives, Republicans in the States. I mean, President Trump has been vaccinated, but sort of secretly, and he doesn't talk about it, and his followers see it as part of who they are, that they're resisting being vaccinated. For some religious people, it's part of their identity. I mean, Christian spokespeople say it's not in the Bible that you have to refuse the vaccine. Indeed, you should be protecting your fellow citizens. But some evangelicals, some Mennonites, some fundamentalist religious people from other denominations and other religions have this view. So if it's built into your identity, I don't think logic, reason, evidence, new studies, new data are going to be persuasive. So there, if it's your spouse or your parent or your child, you may just have to agree not to talk about it. And but if there can be conversation, if people have a limited source of information, maybe you can provide them with what you think is other better information, and you should respect their attempt to inform you about other better information. At the end of the day, I think it is a really divisive issue within families, within communities, and I think we just all have to try to be respectful and civil, and not to be screaming at each other or throwing stones at each other.
Arthur, I think you're aware that of the many, many people who registered and some who could not be here with us today, we got a lot of questions. We got a lot of questions in advance. We had a team of our best people sorting through all the questions. It was really, good on you, Winnipeg Free Press Public, for thinking so much about this topic. Of the questions that we were asked, I mean, I think we've touched on a lot of them, provided a lot of information. There are a few specific ones that I think are probably worth sort of exploring. And I think that and a lot of people raise this issue with me in debating the issue of vaccine mandates. So, we have in your lifetime, in my lifetime, we have faced other enormous public health threats. I mean, really, a lot of them before our lifetimes, actually. But measles, polio, whooping cough,
Tuberculosis.
The really horrible diseases that cut huge swaths through populations before vaccines were available. And it's generally accepted that, we got to where we were going without vaccine mandates. Like so what's different now? Is it just the plethora of anti-vax conspiracy-minded information that's available to people now through the internet? Is it a change in a lack of faith in government? How could we eradicate polio? Different kind of disease, I should say, first of all. That's a big part of it. And yet struggle so much with this when we have examples of the good that vaccines have done.
Yeah. Well, it's really interesting. It's challenging, and it's probably too difficult and subtle for us properly to explore in a brief compass of time. But so let's take polio. The polio vaccine was very effective. Everybody wanted it. And I was a kid in the 50s, and the principal of my River Heights school, Victor Doughton, got polio and was in an iron lung, and my cousin got polio and is limping, and friends, I know people who died. So I don't recall hesitancy. The uptake of the polio vaccine was such that you didn't need to mandate it. People were lining up to get it for themselves and for their kids. Tuberculosis, the vaccine wasn't very good.
Yeah.
So requiring a vaccine, which is now measles, mumps, rubella, I have checked in the recent past. It's mandatory only in 2 provinces. Ontario is one, for school children. And there's another combination vaccine that includes polio and diphtheria and tetanus. They're mandatory, but
with lots of exceptions.
All you have to do is say it's against my conscience and you're excused. Mm-hmm. So it hasn't been a problem if there were a measles outbreak. And by the way, the measles vaccine is required for kids going to school in Manitoba. We're one of the 3 provinces only for measles. If there were a measles outbreak, if there were polio's almost been eliminated from the world. There is some mild wild polio, but it's in distant countries and it's not likely to be a problem in Canada. If it became a problem, and if we have an effective vaccine that's also safe, it might become mandatory even here. So if you don't need to make it mandatory, you shouldn't. Remember, the very first point I made was even a good goal, saving lives, saving illness, protecting our healthcare system, won't justify liberty restrictions unless they're necessary. Right. So if the pandemic is at a very low, if the disease is at a very low level, if it can easily be controlled in other ways by other kinds of public health measures, then requiring that people be vaccinated to go to school or to go to the workplace won't be justified.
Right. Another question that we got, and this kind of flips the legal equation that we discussed earlier a little bit, but when I think about, big class action lawsuits for things like tobacco and OxyContin and things like that, I wonder, and one of our readers wondered, is there perhaps a legal liability facing an unvaccinated person? So, or somebody, let's say, who was deceptive, whether they are not vaccinated but claim that they were, and they end up infecting someone and causing that person some harm.
That's a subtle legal question. So, for example, there have been cases of people who had AIDS or who were HIV positive, who then had unprotected sex without disclosing it to their partners, possibly even denying, claiming that they were negative when they were positive. When those partners have become infected, some of them have, occasionally there have been criminal prosecutions. I mean, the penis or the vagina can be a lethal weapon if you've got a lethal disease. Now, AIDS isn't quite a lethal disease anymore because we've got antiretroviral treatments, and so it is treatable, but the cases are few and far between. It's, if you knew you were COVID positive if you deliberately, knowingly, intentionally exposed a vulnerable person, maybe someone who is immune compromised, deceptively, fraudulently claiming that you were free, that you were vaccinated when you weren't, that you were negative when you were positive. It's possible you could be sued. It's possible you could be criminally charged, but those would be pretty exotic. There haven't been many cases, and whether you'd be liable would depend upon the facts of the case.
Yeah.
The courts would ask, well, was this such a gross violation of the liberty of another person? Was the risk of harm so great? Was the harm so serious that you deserve to be punished or that you should be held financially liable? And it would depend on the facts of each case.
So quite a few of our readers raised this issue, and I suppose it's a big top of mind concern even among people who've been fully vaccinated. But whether or not you foresee a scenario where the vaccine will become, it's not just a mandate, but where in fact it will become mandatory. A government, and this is where we get down to the issue of truly forcing people to be vaccinated and punishing those people who are not vaccinated. Is that completely outside the realm of possibility, or is there a stage of the pandemic or some sort of next evolution of the pandemic that could bring us to the verge of having to make a decision like that?
Yeah, that's a tough question. Look, forcing someone to take a drug, medicine, against their will, assuming we're talking about competent adults, against their will to take medicine is such a serious violation of bodily integrity that it could only be justified in a dire emergency. So is it completely impossible? There have been cases in North America, I'm not sure if there have been any in Canada, where jurisdictions had an outbreak and it was so lethal and so many people were dying that they required everyone to be vaccinated. But that's it's not inconceivable, but it's almost inconceivable. There would almost always be less liberty invasive ways of protecting society. So the restrictions, the masking, the regular testing, it would only be in a dire emergency that the courts would uphold such a serious invasion of bodily integrity, or that people would think that it was ethically appropriate. So almost inconceivable, not quite, but almost inconceivable.
Well, I don't think any of us want to get to that point, and I know we're trying to get to the magic number, whatever that way will be. But I suppose the trump card on the idea that we can achieve the mythical herd immunity through at a level that we use to eradicate things like measles and polio. The trump card in all this, and a lot of people raise this in questions, is the threat posed by the variant. So again, you would have to accept that COVID-19 and the novel coronavirus is a threat. And apologies to any viewers who don't see it as a threat. But if you do accept that, do you believe that the arrival of a vaccine-resistant variant could seismically change even the debate that we're having right now?
Sure. So suppose, for example, that the mu variant, MU, which is predominant in, I'm trying to think, Chile, maybe Bolivia, anyway, a couple of South American countries, Peru, if it came, and it appears to be vaccine resistant, that is, it looks as if the vaccine, so if a variant became predominant in Canada, against which there was no effective vaccine, then there'd be no sense in and requiring the vaccine to go to the Bombers game. If that vaccine escape variant were also highly lethal, I think we'd be hiding in our bedrooms. Remember, COVID has killed a lot of people, and a lot of people have suffered from long COVID and organ damage, and maybe sick for months, or who knows, maybe years. But the Black Death was killing half the people in Europe.
Yeah.
So the death rate from COVID, maybe it's 2%. And then if you add to that the people who become seriously ill and the destruction of our healthcare system or the overwhelming, serious consequences, but only a tiny fraction as serious as the Black Death. So if we get the Black Death, and if we don't have a vaccine, if the variants escape the vaccine, and if they can't tweak it, and if they can't come up with a new vaccine, in which case we'd have a new vaccine mandate, then the vaccine mandate should end, vaccine passport should end, liberty restriction should end, either when COVID ends or becomes just an insignificant background noise, or when we've lost and we have no effective means of, in which case I suppose we go back to public health measures of quarantine, isolation, and escape to the farm.
Well, it's I'm pulling for scenario number one. Fades into the background, but I suppose you have to be a little optimistic. Arthur, this has been tremendous. And for those of you listening at home, if you want to envy me, this is like what I do every day. Apparently they call it work and they pay me for it. It's crazy, but I have conversations like this with really smart people like Arthur, and we try to sort out the problems of the world. And sometimes we do, and sometimes we don't. But anyways. I thought it was really important that we share this kind of a conversation. Now, Arthur, I understand you very generously offered to field additional questions from anybody who didn't feel like we answered their question. So I'm checking with you again. I can now give people your email, and your email, as I believe as well, will be put into the live chat function that's available, I think, through YouTube. I'm looking at the producer who, yes, I got a nod back. And so it's Arthur, ARTHUR .Schafer, SCHAFER, at umanitoba.ca. His email is also available through the University of Manitoba website, which is how I originally found him many years ago. And I will see your offer of an email inquiry service, and I will match that with my email, for better or for worse, is at the bottom of every column I write. If you have a question, something you think wasn't properly answered, or just want to share a thought respectfully, I hope, about something we said, please do email me. If I can't handle it, I will pass it on to Arthur. So Arthur, thank you so much. Like it's been tremendous for our inaugural live town hall event. And any final last brief thoughts?
Yeah, well, it's been a pleasure talking with you. Final thought is that I'm reading the scientific literature and the ethics literature, but I'm following it every day, hours a day, and it's a mess. The evidence you get one week sometimes is inconsistent with the evidence you get the next week. I mean, there are trends. There are some things we know. We've got islands of knowledge in a sea of ignorance. And when the facts change about the safety or the efficacy of about the alternatives, people have been writing to me about a drug called ivermectin, and they say, why have vaccine mandates? Here's a safe, effective treatment, or it's prophylactic, or it's a treatment. My best information is that ivermectin is useless and kind of dangerous and toxic, but many of the people writing to me don't agree. So as we get more knowledge and information, all of us, I think, have to remain somewhat open-minded.
Right.
And we have to keep talking to each other respectfully and listening, and then adjusting our healthcare policies, our individual You know, some of us are more, some of us are less risk averse. So stay healthy, everyone, and keep thinking. And if you do have unanswered questions, drop me an email note. I'd be happy to chat with you.
Thank you, Arthur. I do want to mention very briefly, this is the first in a series that we're calling Reopening Manitoba, weekly series. Next Wednesday at this exact same time, we'll be doing an episode on the food and drink industry and the challenges that they're facing as they try to slowly escape the worst parts of the pandemic. The registration link will also be available in the live chat. And please do read lots, talk lots, and keep an open mind. I think that's a great combination. Arthur, thank you so much.
Thank you, Dan.